In this application, I will show you how you can employ the heel blade on yourself without the assistance of a partner. Most commonly, when treating heel and plantar fascial pain, a lot of the pain does not necessarily originate from the foot, but actually from the lower to mid portion of the lower leg, where the soleus and deep muscles of the lower extremity or the lower leg are located. After applying some proper amount of lubrication, you want to grab the heel blade from its handles, and I generally prefer to start with the wider portion of the blade to allow for better muscle coverage. With mild to moderate amounts of pressure, you want to start at the bottom of the leg, grasp the heel blade, and gently glide up 15 to 20 times, focusing over the most tender areas. You can spend a considerable amount of time on the lower portion of the lower leg, such as the soleus muscle, which is very often extremely tender in runners and cyclists, but you also want to focus on the medial head of the calf muscle as well as the outside lateral head of the muscle. After performing 15 to 20 upward strokes, you want to repeat the same in a downward fashion. You can grasp the heel blade in the most ergonomic method for you. And you certainly want to focus on your counter muscles and come over your anterior tibialis gently, that is, with the curved plate of the blade, 15 to 20 strokes upward, 15 to 20 strokes downward. Now, if an area of point tenderness is identified on the leg, that's a good time to use the narrow or the curved part of the blade for deeper tissue penetration. You want to focus specifically over this area until you essentially work the knot or the tenderness out. After working on the lower leg for a good 2 to 3 minutes, multiple strokes, and proper lubrication, it's time to focus on the foot. Simply cross your leg. I like to go with the narrow portion of the heel blade, grab the blades tightly for better control, and actually glide over the plantar fascia over the heel. Depending on the amount of tenderness and pain tolerance, that will determine how much pressure you apply onto your own foot, heel, and Achilles area. You want to repeat this in both an upward and downward controlled motion, using every aspect of the heel blade for deeper and different myofascial tissue and penetrations.